Spine pathology doesn't always know age, and that's unfortunate. I'm Jones-Quaidoo. I'm an orthopedic spine surgeon, board certified, practicing in the Dallas Metroplex. I recall the story of one young lady who was a nurse in the ER. For this young lady, she did have cervical myelopathy, too much compression of her spinal cord in her neck, and this was affecting her bowel and bladder dysfunction. She had urinary incontinence in her 30s. There was no good reason for this patient to have this problem. She hadn't had a child. She hadn't had any trauma or disease in the lower areas. In fact, she'd even seen a urologist, couldn't find any good reason for her problem. When she was sent to me, I did my evaluation, and I found that she also had some balance issues, and I suspected, hey, we need to look at your neck, only to find out she had severe spinal cord compression in her cervical spine region. The importance here is that you need to take time to understand what the patient's dealing with, what their needs are, and tailor the plan. For this particular individual, I was able to help her by decompressing the spinal cord. In many instances, patients have problems that they don't really want to tell anyone else because they're embarrassed. I would encourage patients to come to a practice like mine, Spine View, where we're going to help you understand you don't need to be embarrassed. Some of these things are outside of their control, and that we can help them, one, understand why is this happening, and then take corrective measures to address it. Sometimes we're able to do this non-operatively, sometimes it does require surgery, but we're going to help them understand their options. If we could help them understand where this is coming from and get to the diagnosis, maybe it is coming from the spine, we could address that. Even if it's not the spine, we could remove the red flag of it's not this area we need to address. We take pride in helping that person get to the next provider so that they can continue to search for treatment and get better overall. If you're dealing with nerve pain down your arm, down your leg, back pain that you can't get rid of, or even other pathologies or problems you're not sure if it's related to the spine, fill out the form on my website. Come on in. Let's devise a plan that's best for you and the community to be taken care of.